Here at the annual gathering of Wisdom Forum in Vancouver, hundreds of people came from across the country to talk about healthcare, including Prime Minister Justin Trudeau, who announced the new Indigenous Health Equity Fund.
This fund will support First Nation, Inuit and Métis partners who can respond to the unique and systemic challenges they face every day when accessing health services.
The $2 billion deal over the next 10 years aims to help clear backlogs, making it easier to receive faster health care and be driven by Indigenous-led regional and community health care needs. As each province and territory enters into bilateral health agreements with the federal government, the Prime Minister says Indigenous people will have a say.
Provinces and territories have a responsibility to ensure that Indigenous peoples have equal access to care when they need it, free of racism and discrimination. These bilateral agreements must respect these rights and principles. Before any deal gets finalized, we'll work with Indigenous leadership to include you in these important discussions. And we'll work together to make sure that there are measurable results.
And during the forum, 84% of the over 170 First Nations ratified the Indigenous Health Equity Fund.
The words that you said in 2015, Prime Minister, is that we reminded us about bringing across real change for First Nations in British Columbia and across Canada. I want to thank you for taking time for being here, the first time ever. Your presence signals a future marked by true nation-to-nation relationships with First Nations in BC, one that is based on the understanding that the constitutionally guaranteed rights of First Nations are a sacred obligation that each of us must carry forward.
And for Patty Hadju, Minister of Indigenous Services, she says this new fund will make a difference.
I know that we are charting a course together that will mean that the young mother with her children can see a brighter future, that the elder person has their needs met in their community and with family, that the person recovering from trauma has culturally appropriate tools that will help them heal. These are big things we're doing together, healing ancient wounds.
Tina House, APTN National News, Vancouver.